Do you eat garlic every day for your heart, your blood pressure, or even to boost your immune system? Garlic can truly be a superfood, but here is the shocking truth most seniors do not know. Eating garlic the wrong way can actually harm your body, weaken your stomach, and even interfere with life-saving medications. That is why in this video, I will reveal the 10 most dangerous mistakes seniors make when eating garlic. By the end, you will know exactly how to get all the healing benefits of garlic without putting your health at risk. My name is Dr. Sam, and after more than 30 years treating older adults, I can promise you this. If you avoid these mistakes, garlic can be one of the most powerful allies for your health. But if you keep making them, you may be doing more harm than good. Before we begin, tell me in the comments, how do you usually eat garlic? Raw, cooked, or as a supplement? I read every response and I would love to know. And if you have not subscribed to Dr. Sam yet, make sure you do it now so you will not miss any of my powerful health tips for seniors. Now we start with number 10, swallowing whole garlic cloves. Many seniors believe that taking a clove of garlic like a pill is the fastest and most effective way to get its health benefits. I have seen people swallow one or two raw cloves every morning with water, thinking it will lower their blood pressure, thin their blood, or protect their heart. But here is the dangerous truth. Swallowing whole cloves actually reduces the benefits of garlic while increasing the risks. Garlic contains a powerful compound called allicin, which is responsible for most of its healing effects. Allicin helps reduce blood pressure, fight inflammation, and support circulation. But lysine is not naturally present in garlic. It only forms when the clove is cut, crushed, or chewed, because that is when an enzyme called alliinase is activated. If you swallow garlic whole, the clove passes through your stomach and intestines without releasing much allicin. In other words, you get very little benefit, almost like swallowing a stone. Worse, swallowing large cloves can irritate the lining of your stomach or even get stuck in your esophagus, especially for seniors who already have swallowing difficulties. In some rare cases, I have seen patients develop bloating, stomach cramps, or even obstruction because the garlic was not digested properly. I remember Helen, a 66-year-old retired nurse from California. She told me she had been swallowing one clove of garlic every night before bed for almost a year, hoping it would help her cholesterol. Instead, she began suffering from stomach pain and acid reflux. After a checkup, we discovered that her stomach lining was irritated. Once she stopped swallowing whole cloves and began chopping and letting the garlic rest before cooking, her symptoms improved and she was finally able to enjoy the benefits without pain. Here is the safe way. Always chop, crush, or slice garlic before consuming it. This activates the alliinase enzyme and allows allicin to form. Let the chopped garlic sit for about 10 minutes before cooking or eating to maximize its potency. If raw garlic is too strong for your stomach, lightly saute it in olive oil or mix it into cooked dishes. You will still get many of the benefits without the harsh side effects. Swallowing garlic whole may seem easy, but it is one of the least effective and potentially dangerous ways to use this powerful food. Do not waste your effort. Prepare garlic the right way so your body can actually use it. And speaking of effort, many seniors think they are saving time by buying garlic that is already peeled and packed in jars. But mistake number 9 will show you why that convenience can actually rob garlic of its strength and even expose you to hidden dangers. Number 9 is relying on a pre-peeled or jarred garlic. At first, it sounds so convenient. You open the fridge, grab a jar, scoop out a spoonful of minced garlic, and drop it into your pan. No peeling, no chopping, no smell on your hands. Many seniors prefer this because it saves time and feels easier on tired joints. But here's the problem: pre peeled and jarred garlic loses most of the compounds that make garlic so powerful in the first place. Fresh garlic cloves are full of allicin and alliinase, the two compounds that combine to form allicin, the magic ingredient that lowers blood pressure, reduces cholesterol, and protects your heart. But the moment garlic is peeled and exposed to air, those enzymes begin to break down. Within hours, much of the potency is gone. By the time garlic is chopped, jarred, and sitting in oil or preservatives on a supermarket shelf, there may be little allicin left at all. What you are really buying is flavor, not medicine. Even worse, some jarred garlic products contain additives to preserve color and prevent spoilage, such as citric acid or phosphoric acid. These chemicals can irritate a sensitive stomach and may reduce nutrient absorption. In rare cases, improperly stored jarred garlic in oil can even harbor dangerous bacteria like Clostridium botulinum, which produces a toxin that is deadly in small amounts. Let me tell you about Mark, a 71-year-old widower from Arizona. He loved cooking pasta and stir fry, but because his hands shook from arthritis, he relied on big tubs of pre-minced garlic. He thought he was doing something good for his heart. After a year, his blood pressure and cholesterol hardly improved, despite his garlic-heavy diet. When I asked what kind of garlic he used, he admitted he had not touched a fresh clove in years. We switched him back to chopping fresh garlic, letting it rest for 10 minutes before cooking, and within 3 months, his blood pressure dropped by 12 points. Mark could hardly believe the difference. So here's the solution. Whenever possible, buy whole bulbs of garlic and peel them fresh at home. If peeling is difficult, use simple kitchen tools like silicone garlic peelers or garlic presses that reduce hand strain. Chop, crush, or slice the cloves yourself. Then let them sit briefly before cooking to activate the allicin. You will get far more health benefits from a single fresh clove than from a whole jar of pre-minced garlic. Now, even when seniors use fresh garlic, many still make the next mistake. They cook it the wrong way, destroying the very compounds they're hoping to benefit from. Let's move on to mistake number 8. Number 8 is overcooking garlic. Garlic is full of delicate enzymes and sulfur compounds that give it its healing power. But these compounds are also very sensitive to heat. The moment you expose garlic to high temperatures for too long, most of the beneficial allicin is destroyed. What you are left with is flavor, but almost none of the medicinal effect. Research has shown that heating garlic at 150 degrees Celsius for just 5 minutes can completely deactivate the enzyme allicin, which is necessary to form allicin. This means if you toss chopped garlic into very hot oil and leave it sizzling until it turns brown, you have essentially burned away its health benefits. The solution is simple. Always add garlic toward the end of cooking, not the beginning. Lightly saute it for no more than 30 seconds to 1 minute over gentle heat, just until fragrant, and then add your other ingredients. Another powerful method is to crush or chop garlic, let it rest for 10 minutes to form allicin, and then add it to cooked dishes off the heat. This way, the beneficial compounds remain intact, and your body can actually use them. Overcooking garlic is one of the most common mistakes because people focus on flavor instead of health. But if your goal is to protect your heart, improve circulation, and fight inflammation, handle garlic gently. A little patience and lower heat can make all the difference. But even if you cook garlic perfectly, You could still be sabotaging its benefits if you store it the wrong way. Mistake number 7 is all about storage, and many seniors do it completely wrong. Number 7 is bad storage. Garlic may look tough on the outside, but it is actually very sensitive to how you keep it at home. Many seniors make the mistake of storing garlic bulbs in the refrigerator, in sealed plastic bags, or even in oil. These methods can either reduce garlic's potency or make it unsafe to eat. When garlic is kept in a damp or cold environment, such as the fridge, it begins to sprout. Those green shoots mean the clove is losing its natural compounds and its flavor. Sprouted garlic is not toxic, but it has far less allicin potential compared to fresh, firm cloves. Another mistake is storing garlic in airtight containers or plastic bags. Without proper airflow, garlic can develop mold, and the moisture trapped inside can encourage bacterial growth. The most dangerous mistake is keeping raw garlic in oil at room temperature. This creates the perfect environment for botulism, a rare but potentially deadly foodborne illness. The best way to store garlic is simple and traditional. Keep whole bulbs in a cool, dry place with plenty of air circulation, such as a mesh bag or an open basket on the counter. Do not refrigerate whole heads. Only peel cloves when you are ready to use them, because peeled cloves lose their potency quickly. If you want to prepare in advance, peel a small batch, store it in a sealed glass container in the refrigerator, and use within a few days. Proper storage ensures that garlic keeps its healing compounds intact for weeks or even months. Mishandling storage may not seem like a big deal, but it can quietly strip away the very benefits you were hoping to gain. And even when garlic is stored correctly, it can still be dangerous if you forget about one critical factor: drug interactions. Mistake number 6 can turn garlic from a healing food into a hidden risk. Number 6 is ignoring drug interactions. Garlic is often called natural medicine, but just like real medicine, it can interact with the prescriptions many seniors take every day. This is one of the most overlooked dangers. Garlic has a natural blood thinning effect because it reduces platelet aggregation. That can be helpful for circulation, but if you are already taking blood thinning medications, such as warfarin, aspirin, or clopidogrel, adding large amounts of garlic can increase your risk of bruising or even internal bleeding. Garlic can also enhance the effects of blood pressure medication, causing blood pressure to drop too low. And if you are on certain HIV drugs, garlic may reduce how well those medicines are absorbed. A study published in the Journal of Clinical Pharmacology found that patients on anticoagulant therapy who also consumed large amounts of garlic extract had significantly longer bleeding times compared to those who avoided garlic supplements. For a senior, this can mean a simple cut that bleeds much longer than expected, or a higher risk during surgery. The lesson is not to avoid garlic altogether, but to use it wisely. If you are on prescription medications, always talk to your doctor before adding garlic supplements or large amounts of raw garlic to your daily routine. In most cases, moderate use of garlic in cooking is safe, but high-dose capsules or multiple raw cloves daily should be discussed with a healthcare provider. Garlic can be a powerful ally, but only when it works with your medications, not against them. Ignoring interactions can quietly turn a healthy habit into a hidden danger. And even if garlic does not interfere with your medicine, it can still upset your stomach if you take it at the wrong time. Mistake number 5 is especially common among seniors with sensitive digestion. Number 5 is eating raw garlic on an empty stomach. Many seniors believe that chewing a clove of garlic first thing in the morning will maximize its healing effects. While raw garlic does contain the highest amount of active compounds, swallowing it on an empty stomach can do more harm than good, especially for older adults with sensitive digestion. Garlic contains strong sulfur compounds that can irritate the lining of the stomach. Without food to buffer it, raw garlic can trigger heartburn, nausea, or even gastritis. For some seniors, this irritation can be so severe that it leads to stomach ulcers or worsens acid reflux. Instead of boosting health, the habit leaves them with pain, bloating, and discomfort that lingers throughout the day. A study published in the Journal of Nutrition noted that while garlic has clear cardiovascular benefits, excessive raw garlic intake without food was associated with increased gastrointestinal complaints, especially in participants over 60. In other words, the stomach needs protection if you want to safely enjoy garlic's power. Here is the safe approach. If you enjoy raw garlic, always take it with food. Mix chopped garlic into yogurt, avocado, or olive oil, or spread it lightly on whole grain toast. These foods coat the stomach lining and reduce irritation while still allowing allicin to be absorbed. Another option is to lightly saute garlic or mix it into warm soups, which makes it gentler on the stomach but still effective. Garlic should strengthen your body, not make you feel worse. If raw garlic on an empty stomach leaves you with pain or indigestion, it is a sign your body is asking for a safer method. But stomach irritation is not the only hidden danger. Garlic can also cause problems if you use it at the wrong time, especially before medical procedures. Mistake number 4 is something every senior should know before a surgery or dental visit. Number 4 is using garlic close to medical procedures. Garlic's natural ability to thin the blood is often celebrated as good for circulation, but this same effect can be dangerous when you are preparing for surgery or even a simple dental extraction. Many seniors do not realize that eating large amounts of garlic or taking garlic supplements right before a procedure can increase the risk of excessive bleeding. When you go into surgery, doctors need your blood to clot normally so wounds can close and heal. But garlic slows platelet function, meaning your blood does not clot as quickly. If you are also taking prescription blood thinners, the effect can be even stronger. This can lead to complications during and after the procedure, from prolonged bleeding to slower recovery times. The American Society of Anesthesiologists has specifically warned patients to avoid high-dose garlic supplements at least 1 to 2 weeks before scheduled surgery. This recommendation comes from multiple studies showing that garlic extract can significantly prolong bleeding time, even in otherwise healthy adults. The safe approach is clear if you have a planned surgery, dental procedure, or even a colonoscopy. Always tell your doctor or dentist if you are eating a lot of garlic or taking garlic supplements. They may recommend reducing your intake temporarily to minimize risks. Once you recover, you can safely reintroduce garlic into your diet to support healing and long-term health. Garlic is powerful, but timing matters. Knowing when to pause, it can prevent dangerous complications. Now, even when garlic is eaten at the right time, many seniors still miss one critical step that unlocks its healing compounds. Skip this step, and you lose most of garlic's benefits. Number 3 is not letting garlic rest. Most people chop or crush garlic and immediately throw it into the pan. It seems harmless, but this small mistake can rob garlic of nearly all its healing power. Here is why. Garlic's most important compound, allicin, is not present in the clove until it is chopped, crushed, or sliced. When you cut into garlic, an enzyme called allinase is activated, and it needs a few minutes to fully produce allicin. But the moment garlic is exposed to high heat, that enzyme is destroyed, and the process stops. If you put garlic straight into the pan right after chopping, very little allicin has had the chance to form. Several studies have confirmed this effect. Research in the Journal of Nutrition showed that letting garlic rest for just 10 minutes after crushing dramatically increased allicin content and preserved more of its cardiovascular benefits, even when cooked lightly afterward. Without this resting period, the health effects were almost completely lost. The solution is simple. After chopping or crushing garlic, let it sit at room temperature for about 10 minutes before cooking. This short pause gives the enzymes time to finish their work and ensures the allicin is locked in. Once formed, allicin is more heat stable and will survive gentle cooking, meaning your meals will deliver both flavor and health benefits. Skipping this step is like throwing away medicine before it has a chance to work. With just a little patience, you can unlock garlic's full potential and truly harness its healing power. But even if you prepare garlic the right way, many seniors still ruin it in the kitchen by cooking it at the wrong temperature. Mistake number 2 is one of the most common habits, and it silently destroys garlic's benefits. Mistake 2, cooking temperature. Garlic is delicate. Its powerful healing compounds are highly sensitive to heat, and many seniors unknowingly destroy them in the kitchen. The problem comes when garlic is exposed to very high temperatures for too long. When garlic is fried until golden brown or left sizzling in hot oil, the enzyme allinase is destroyed within minutes, and the precious allicin it creates is completely lost. What remains is only flavor. Delicious, yes, but with little or no health benefit. A study published in the Journal of Agricultural and Food Chemistry showed that heating garlic at high temperatures for more than 5 minutes eliminated most of its antioxidant and cardiovascular activity. The fix is simple. If you are cooking garlic, keep the heat low and the time short. Add it toward the end of cooking instead of the beginning. Lightly sauté for less than 1 minute until it becomes fragrant, or stir it into warm dishes after they are taken off the heat. Another powerful method is to let chopped garlic rest for 10 minutes before cooking, so the allicin has already formed and is more resistant to heat. Overcooking garlic is one of the easiest mistakes to avoid, yet it is also one of the most common. Handle garlic gently, and it will reward you with strength, vitality, and protection. And now we reach number 1, the most common and most dangerous garlic mistake of all. It is something so basic that many seniors never think about it, yet it can make the difference between garlic healing your body or harming it. And at position number 1, the biggest mistake is pairing garlic with heavy, greasy meals. Fried or fatty foods overwhelm digestion and prevent allicin from being absorbed. Instead of protecting your blood vessels, garlic gets buried under layers of fat and loses much of its power. To get the most from garlic, combine it with simple foods like olive oil, vegetables, or a small amount of protein. This way, the allicin works fully to support your heart, blood vessels, and immune system. Now you know the 10 most dangerous mistakes seniors make when eating garlic. From swallowing whole cloves to relying on jarred garlic, to cooking it too long, to storing it the wrong way, these habits can weaken garlic's healing power or even put your health at risk. The good news is that with small changes, you can make garlic one of the most powerful allies for your heart, your blood pressure, and your immune system. Which of these mistakes have you made before, and which tip will you start using today? Tell me in the comments below. I read every one of them. And if you have not subscribed to Dr. Sam yet, Make sure you do it now so you will not miss any of my simple and powerful health tips for seniors. Stay strong, stay healthy, and I will see you in the next video.